Right now we're going into Friday morning, which is October 25th, the day that she was born. I got the Cytotec pills every 4 hours until about 9 a.m. The doctor came in on Friday morning and checked me, and I was at a 3. So in 2 days, I had dilated 3 centimeters, and I still wasn't even 100% effaced. So we were restarting the Pitocin, and she was just like, well, you know, why don't we, she was happy with the 3, and she was like, well, why don't we just break your water? And I was like, oh, okay, go ahead. Because I knew this was like showtime. When she broke my water, I knew that the contractions were really going to start, and it was going to hopefully be, you know, showtime. So she broke my water. I had my nurse in there. My nurse that I had this day, all the nurses that I had, except with the exception of that one midnight nurse, were absolutely fabulous. And the one who was with me the day I delivered was exceptional. She was fabulous. There was also a student there, which I totally welcome because I was a student at one point too. So he was able to see a lot that day in the little bit of time that he was with me. So I said, okay, go ahead and break my water. That was the most uncomfortable procedure I had during the whole labor and delivery experience. You're getting hungry, aren't you? It was the most painful procedure. It was uncomfortable. It was painful, it hurt, and it was traumatizing for my husband because he had watched everything up until that point, and he said, you know, I watched them stick this hook up in you and it came back covered in blood. And he's, oh, I know. It was traumatizing. I know. So we're at the point now where after they broke my water, I was still on Pitocin, and the contractions had really started. Normally for someone who's going through natural labor, you know, you have like a contraction's like a crescendo. It goes up into a peak and then comes back down, and then you get a little rest period, and then it starts all over again. My contractions on Pitocin were nothing like that. They were like stacked 3 on top of each other, and then I would maybe get like a 30-second rest period, and then it would happen all over again. And it was part of my birth plan to get an epidural the whole time, but for whatever reason, once my labor started, my weird like competitive side came out for no reason, and I was just like, I want to see how long I can labor before I get the epidural. So I labored for 3 hours. So they broke my water at 10. I labored until 1 o'clock. And right before the doctor rechecked me, I said, you know what? I bet I only dilated a centimeter. I bet I'm at a 4. And she checked me and she was like, yep, you're at a 4. And I was just like, I was being so stubborn. And as soon as she told me that, I kind of have an epiphany. And I was just like, what am I doing? Like, why am I suffering for no reason? You know, it was, you know, the contractions were painful. Like, I was getting really like bitchy because I was in pain, and then I was just like, God, all that work, you know, for 3 hours for 1 centimeter. I was just like, you know what am I waiting for? So I said, okay, let's do the epidural. Let's do this thing. And they came in and did the epidural. And the epidural was probably the second most uncomfortable procedure behind the breaking of the water. Just because I was under the assumption from what I had read and watched that, you know, the anesthesiologist will stop when you're having a contraction. They don't do that. They just make you breathe through it. So remember, my contractions were like 3 on top of each other. So I had to breathe through all those contractions and not move. And the thing was, that's my dog. And the thing was is that they would like zing you. They would tell you not to move, and then they would like inject something in you that made you kind of jump. And so I was kind of working myself up, and I'm like, oh God, stop jumping, stop jumping. So I was trying to lay as still as I could, and it took a while for the anesthesiologist to be done. So at that point, the epidural was in. The nurse kind of kicked my husband and my mom out of the room and said, you know, let her rest a little bit, go get lunch. And after they left, they said, okay, we're just gonna go ahead and put the Foley catheter in you. And then they talked about putting in the the internal monitors to monitor the contractions and to monitor the baby. The nurse said, do you want to do it? And the doctor said, yeah, go ahead and just do it. And as soon as they put in the monitors, they noticed that she was having decelerations again. And they noticed that they were pretty bad, and they were actually getting worse with each contraction. So they said, okay, we're gonna watch this just a little while longer, but we're gonna have the talk just in case something happens and we need to make a decision. So at that point, like I said, it was just me in the room. I attempted to call my husband and my mom because they were just down in the cafeteria getting lunch. I could not find my phone. It turns out my husband took it. I still don't know why he had my phone. And I called them from the room phone. They didn't answer. I called them from my work phone that I had with me, and they didn't answer. So then I text my mom from my work phone, and I said, this is your daughter, will you please answer the phone? And she answered, and I told them what happened, and I said, you know, come back up here, we're talking C-section. I was upset about it, but also at that point, it's like I had been in the hospital this was my 3rd day, and I was just like, you know what, the best result is just a happy, healthy baby. Heck, I was going into stress near the end of it, so I just said, you know what, whatever is best for her. There really was no discussion to be had. I said, let's, you know, just go ahead and do the C-section. Okay, so we decided to do the C-section, and things really kind of kicked into high gear at that point. They prepped me in the room. They put in my Foley. The anesthesiologist came in. I signed all the consent forms, and they were moving pretty, you know, efficiently and quick, which I was fine with. So then they wheeled me into the operating room. And I got separated from Matt at that point because they were prepping me. So they moved me over, and remember at this point I had epidural, so I was like completely numb from the waist down. They moved me over to the table, and they started prepping me. They gave me more medicine for my epidural because I went from my legs feeling tingly to my legs feeling like they were like dangling in the air. And I just felt very heavy. And they prepped me, they moved very fast. They put me on oxygen, which I think was just a precaution, but that kind of got into my head a little bit. I kind of had to talk myself down because I was getting a little claustrophobic from the oxygen. And then Matt came in. They put the drape up so I couldn't see anything, and they started the procedure. I know a lot of women say that they feel like a lot of tugging, pressure, all that stuff. I felt nothing. I felt absolutely nothing. I was just really focusing on my breathing, trying to stay calm, because in that situation it's really easy to let yourself go and to freak out. Like at that point my job was just to stay calm and to kind of stay present and to stay in the moment. So the C-section was going along. My doctor at one point told me that she was going to have to possibly use the vacuum to get her out because she was at a weird angle. She was still at my pelvis. She was not even in the birth canal. And probably the position of where her head was what was stopping her. So she did say that they may have to use the vacuum, which I wasn't happy with. But luckily, my doctor was able to maneuver and to get her out without using the vacuum. It was, I would say, you know, the environment in the room was very calm. I think some people may have a problem with the fact that the staff that was in there was kind of, you know, talking about, you know, what shifts they work. It was a Friday. What are they going to do that weekend? I kind of found that comforting because that made it feel like everything was going according to plan, and this was just a routine procedure. So, after she told me that she may have to use the vacuum and didn't, they were getting ready to pull her out, and at the point that they were getting ready to pull her out, they told Matt he could stand up and watch, and then they dropped the curtain and put a mirror for me to see. Unfortunately, they had the mirror angled the wrong way initially, so when I was looking in the mirror, all I saw was my doctor's face, but then they adjusted, and I did get to see her. I saw her right after she came out. I didn't see them pull her out of me. But it was not the moment that I had expected. Because when I saw her in the mirror, she was completely purple and completely limp and did not cry. She was completely limp and completely purple and did not cry when she came out. And it was I didn't expect it, but I also didn't get worked up over it either. They took her over to the warming station, and I did see them, you know, shaking her and like kind of, you know, jostling her to get her to wake up. She still did not cry. At this point, everyone, it seemed, had left me and went over to her, including Matt. Matt was kind of in between us, and he kept looking back at me and then looking at her. And I was watching them very closely, and I was just like, I just remember, I just kept saying in my head, please cry, just cry, just cry, just cry. And then it slowly turned into, why isn't she crying? Why isn't she crying? Why isn't she crying? So I watched them grab the Ambu bag and start to give her breaths, or rescue breaths as we call them. I know what an Ambu bag is. I know what it's used for. It's used when people are not breathing, and it breathes for you. And I watched them do that, and I was still silent. And then I watched the nurse like go to grab her, and it looked like she was going to grab her around the chest. And like, to me, it looked like she was about to start doing chest compressions. And I was like, if I watch this nurse do chest compressions, I'm gonna lose my mind. And like I said, at this point, I thought that everyone had left me. So I kind of just said out loud, thought I was talking to my doctor who was on the other side of the drape, and I just kind of said, you know, someone needs to explain to me what is going on, or I'm about to freak out. No, I said, someone needs to tell me what's going on, or I'm about to lose it. That is what I said. And turns out the anesthesiologist was behind me the whole time. I just couldn't see her, and she explained to me that that is normal. When babies go down the birth canal, all the fluid gets squeezed out of them. So because she did not go down the birth canal, that is why she came out, you know, purple, and she came out, she was full of fluid. That was why she couldn't breathe. So they had to get all the fluid out, and it was about a minute before she cried, and it was a little cry. And then the NICU, we had 2 NICU nurses in there. They came over and talked to me and explained to me what was going on, and said that she was going to go to the NICU. She could be there she could be there for 4 hours, which would be observation. If she was there past 4 hours, she would be admitted to the NICU. So I was just like, oh my God, like what is happening, you know? And I felt guilty. I felt guilty because we had a hard time picking her up on the monitor before the internal one got put in. So I kind of asked the nurse, I'm like, you know, could I have caused her to be harmed by me, you know, not getting the epidural sooner so those, you know, probes weren't put in? Could we have been missing something on the monitor? And she told me no. She said that if she was in any sort of harm, that the monitors would have picked it up, the normal monitors. So after she was taken to the NICU, I was taken to recovery. Matt was with me when we went to recovery, and I don't even know timetables. At some point he got to leave and got to go to the NICU to be with her. And then he sent me a text a little while later that said, I'm bringing her to you. And she got discharged from the NICU. So she was there, I think, less than 2 hours. She did really well. So then she got to be in recovery with me. We got to do skin to skin. I forgot to say Matt got to like partially cut the cord after she was out. The staff was really great with letting, you know, him take pictures. They took pictures of him cutting the cord. So we didn't miss any of that. So I was in recovery for about 2 hours, and then I was taken back to my room. Yeah, and that was pretty much it for like the labor part of it. My epidural was taken out when I was in the OR. They did give me a dose of a medication that stays in your system and works for 24 hours after it is given, so that medication really helped. My My recovery from my C-section has been fabulous. I was up walking that night even though I didn't want to. I still had my catheter in. They made me get up and go to the bathroom to kind of clean myself up because you do start to bleed. And so I was up that night and then stayed in the bed the rest of the night because I still had my catheter in. I got it removed the next day. I had my IVs out by that next day. But I did have to stay in the hospital for 3 days after the C-section, so I was in the hospital for 5 days total. And it was pretty torturous for just wanting to take our baby home, and you know, you don't have the comfort of your bed, you don't have all your stuff that you want to use on her, hospital food, you know, and you're stuck in this little room, you can't go outside. So 5 days was a long time, but we got to take her home. She was born on Friday, we took her home on Monday. And yeah, like I said, the recovery has been pretty good. I mean, I bounced back so quick after a C-section. I never thought I would do that, but I'm still following my recommendations on restrictions because I don't want to mess anything up. And yeah, I mean, it's been pretty smooth. Pain was minimal. I did take pain medication for the first couple days after as more for a prophylactic measure, but then stopped taking them maybe like 4 days after I got home altogether. And yeah, things have been pretty good. Still bleeding minimally. I'm now almost a month postpartum. It's Monday. On Friday, she will be 4 weeks old, so I'll be 4 weeks postpartum. I just have to wear like a panty liner. Yeah, and that, yeah, I've actually thinking about getting an elective C-section on my next kid because it was so smooth and the recovery was so easy. My doctor did a fabulous job. I also think it helped that I was pretty active up until the day I was induced. I was taking my dogs on walks, my dog on a walk every morning, and just trying to stay active, even though near the end of pregnancy you don't want to do any of that. So yeah, that's all I can think of right now. That is her labor and delivery. That's my labor and delivery story. That's her birth story. If you have any questions, please let me know. And yeah, I mean, this is going to be the first in a bunch of mommy videos because like I said, I have no idea what I'm doing and I have nobody to ask questions to. So if you guys have any questions or want to know how she's doing, just let me know. And I'm going to be filming more videos soon. So if you were watching this, thank you for watching. And if Everly was not knocked out by this bottle right now, she would say bye, but she's she's nice and yeah, she's nice and milk drunk at this point. So I'm going to burp her and let you guys go. And like I said, thanks for watching and I'll see you again. Bye.